Okay, so in today's class, I will discuss related to the community health centers. Okay, so community health centers are because actually in the healthcare we are going in the level basis. So at the lower level, we have a sub center, this which is mostly seen in the rural areas. Okay, so the main aim of the sub center actually it is to cover those population which are very in the outskirt area. Okay, where there is not much hospitals and all, it's not much available. So it all those we try to cover up with the help of the sub centers. Okay, and after that the next level it is the primary health center, and we have at the top level is the community health center. Okay, so community health center mostly it is will provide more population coverage. Okay, and it will also have more services as compared to your primary health center and the sub centers. Okay, so I'll be sharing my slides. Okay, is it visible? Yes.
And no, ma'am.
No, not visible.
Yes, ma'am.
Yes, ma'am, visible.
Yes, ma'am. Okay, so last time we have discussed about the subcenters. Okay, so this is a subcenter. Everything we have to remember, we are following the IPHS. IPHS stands for the Indian Public Health Standards. Okay, so they are the one who give the standards for the staffing. They are giving the standards for how many service, what are the services needed. Okay, and if you still remember, I have told about essential and desirable services. So whenever we say essential, that means these are those which is compulsory. These services should be there, and desirable means if permit or if we have extra. Okay, so we can have those. Okay, those are like extra service. So we have discussed last time also about the primary health center. Okay, so type A and type B, like I have said. Okay, then we have seen about the staffing pattern. So directly I will move on to the IPHS standards for the community health center, and in short we call it as a CHC. Okay, as you can see in the diagram. Okay, so that is actually one CHC center which is present in Dhiranpara. Okay, if you have heard. Okay, so this is also called as a maternity and child welfare hospital. So this center actually it is in Dhiranpara, Guwahati, and this is a community health center. Okay, so a community health center actually it is also called as a first referral unit. Okay, why we call it as a FRU? Because whenever any people, okay, if suppose if they visited a sub center or a primary health center, so whenever they transfer them, or if you remember, referral is like transferring an individual or patient. Okay, so why do we mostly transfer, especially if suppose if that person comes to that particular center and if they don't have that particular services needed, so in order to to treat the patient or to save the life of the patient, they will try to upgrade to send him to a more high level type of centers. So that is actually what is the meaning of referral. So similarly here, a community health center it is also called as the first referral unit, because whenever any individual it is being sent, okay, to the centers, any sub center or primary health center, so from there they will first transfer the patient directly in the community health center. So that's why it is called as a first referral unit, or in short we call it as a FRU. Okay, and here actually if you compare it with the previous centers, it provides more health services. They will cover more population. Even if you see here, it covers 80,000 to 1,20,000 population. Okay, so it covers actually a huge numbers of population coverage. And what are the staffing pattern here? Okay, so if you see, it is divided into the block public health unit, specialty services, general duty officers, nursing, and the paramedic staff. Okay, so if you talk about the personnel what are under the block public health unit, so we need a medical officer, block medical officer, or a medical superintendent. Okay, we need one. Okay, then a public health specialist, we need one. Then a public health nurse, one. And desirable means if extra, okay, if they have extra manpower is, if it is possible, then they can keep one more, desirable. Okay, then specialty services means these are those which will provide all the special services. Suppose it can be a surgeon, okay, he'll perform some surgeries, or it can be, whenever we say obstetrician and gynecologist, these are those doctors who are usually specialized for related to the mother and child, that means delivery of the child. Okay, then related to any gynecological problems, so all these doctors, they are specialized in those. Okay, pediatrician is for the children. Okay, so up to 18 years. Okay, so all those adolescent and all, they will be considered under pediatrician. Okay, so anesthetist. Okay, especially because actually what happened in CSC, actually it will they will have even the OT services or the operation theater service also. They will perform some or OT and all, surgery and all. So for that, we need an anesthetist. Okay. So these are the specialty services which will be provided in a community health center. Then if you see what are the general duty officers, we need a dental surgeon, okay, because also in a CHC they have also some dental OPD, okay. Then we need a general duty medical officer. Then also we need a medical officer for Ayush, okay. So these are also a dental surgeon, we need one, a general duty medical officer two, and a medical officer for Ayush one, okay. Because actually nowadays even Ayush also it has been implemented in most of the centers and all, okay. So those who wants to go for Ayush treatment and also they can go in they can avail those treatment. Then the nursing and the paramedic staff. For a staff nurse, we need 10, okay, essential. A pharmacist, we need one. And again, if desirable, we can have one more. Then a pharmacist for Ayush, also one. A lab technician, two. Then a radiographer, okay, for doing all those X-ray and, okay, those we need two. Then lab technician two and radiographer one, and a dietitian actually it is desirable, so it is not compulsory that a dietitian should be there in a community health center, okay. Even in that center which I've shown you, okay, Dhiranpara, they don't have any dietitian, okay, as such till now. Then ophthalmic assistant, okay, we need one. Then with dental assistant also one. Cold chain and vaccine logistic assistance one. Okay, cold chain actually it is that area where all the vaccines are stored for immunization. Okay, actually what happened, we have like a country, we are following actually the national immunization schedule, okay, where all the children they are being immunized against many killer disease, okay. So in that room, a cold chain room, actually it is a room, it is like a cold storage where all the vaccines will be stored. So for that also actually we need some person to manage that, okay, to see, to relate it to the numbers of vaccine available there, related to the temperature, because we need to maintain some specific temperature also we have to maintain so that the vaccines will not get spoiled, okay. So for that we need a cold vaccine and a vaccine logistic assistant, so those people they will be seeing all those. Then we need a OT technician, okay. Then we need also a multi rehabilitation, community-based rehabilitation workers. So one is essential, and again, one more desirable. Then a counselor one. Then the administrative staff. That means it will come all your official staff, which will do all those official work and all. Okay. So all those six group D staff like a housekeeping and all those. So those seven, and if desirable, three more we can add. So a total staff. Okay, essential it is 46 and desirable, okay, 52. So these are the staffing pattern which we need in a community health center. Okay, as you can see here, we have more and more staffing. We have more and more staff as compared to the PHCs also, because here they will have more services. So what are the infrastructure, if you see in a community health center actually? So here the setting should be in such a way that at least 30 beds should be there. Okay, so at least 30 indoor beds should be there. There should be one OT room, okay, operation theater, one labor room. Labor room is where it is usually used for delivery of the child and all. Okay, so for that we need a labor room. Then one newborn care, okay. So whenever we have a labor room, actually makes that automatically the newborn care room also will be there, okay. So for taking care of the newborn babies and all, okay, in which all the radiant warmer, okay, which is all the basic things required for a newborn child, okay, all should be there in this newborn room. Then X-ray facilities, okay, it is also there. Even in Dhirampara also, the one which I've shown, they also have X-ray. Laboratory services also there is to do simple blood test, okay. All those also is being done, like suppose urine testing, testing for your hemoglobin, okay, all the testing for malaria, HIV, AIDS, all this are done in the lab. Okay. Then transport facilities also, they used to have some ambulance, okay, some transportation vehicles. OPD, okay, they usually have separate OPDs for different specialities, like for obstetric and gynecological, they will have two, okay. Then for dental OPD also they'll have one more. So like that different specialty, they will have different OPD rooms. Okay, if you if anyhow if you have visited that Dhiranpara, no, you'll be seeing all those. So they have so many OPDs. So different specialty, like for pediatrician, they'll have one room. For the ops, mostly they use two rooms because this obstetric and gynecological patients, they used to be more in number, okay, so they usually have two OPDs for them. Other than that, they have one. Then they also have an emergency area, okay. So in the emergency area, at least if anyone if any first aid is needed, if anyone is having any form of injury that needs to be stitched, okay, stitch or in or suturing, so that will be done in the emergency room. Okay, also they have one room for the doctors, one room for minor OT. Okay, in minor OT only they'll do all those first aid. If anyone is having any injury or cut, they will do stitching and all those. Okay, one room for dressing, for doing some dressing or bandaging and all those. Then one room for the patient observation with 4 beds. Okay, so these are the infrastructure which is needed. Okay, these are the minimum requirements infrastructure for a community health center. Okay, so apart from that, they also have a pharmacy. Okay, residential accommodation. So actually, even in this Dhiranpara, okay, that community health center which I have shown, at the backside of the hospital only they have the quarter for all the staff. Okay, the doctors and even for the nurses. Also, they have wards. Okay, they have usually 4 wards with 6 beds. So 2 male and 2 female wards actually used have to be there, like for male medicine, male surgery, female medicine, and female surgery. Okay, 4 private rooms also usually there. Even in the Dhiranpara also, which I have shown, subcent CHC, they have private rooms. Okay, 2 isolation rooms, okay, where we used to keep any infectious, if any patients comes to the hospital, to the center with any suspicion of having any infectious disease, okay, which can be communicable to the another people and all, or even to the another patients. So they will keep those individual in a isolation room. For example, a person having dengue or a person with tuberculosis, and even at present coronavirus is going on, so like those type of patient, we keep them in an isolation rooms. Okay, then officers need to be there. Injection room, so injection room, it is where specifically where all, if anyone needs to get any form of injection or even the vaccines, okay, for the all the children, and all those are given in the injection room. Then they have an observation room and a storeroom. So in a storeroom they will keep all the articles and all, okay, were required for the CHCs. So these are the infrastructures, minimum infrastructures that a CHC should have. Okay, so if you talk about what are the services provided, first of all, they have an OPD clinics. Like I have said, they will have separate OPD for different specialities. Okay, so they have OPD for medicine, they have some surgery also, pediatric, ops and gynecological, dental clinic, eye clinic. So all these OPDs clinics are being available. Okay, and most of the OPDs are functioning every day except on Sunday. Okay, so usually on Sunday it remains closed, but all the other indoors services will be provided. So OPD, it is usually open 6 days in a week. Okay, so and on except on Sunday it is usually closed. Then the next facilities is care of routine and emergency cases in the surgery. Okay, so whenever we say routine and emergency case, suppose if a person needs to be taken, if he needed any form of surgery, like suppose for he's having any appendicitis, okay, where the appendix needs to be removed, or any stone in the gallbladder, so those type of surgery, or even emergency cases which needs emergency surgery, so those type of services also, it is being provided in a community health center. Okay, then care of routine and emergency cases in the medicine. So if it's a medicine, suppose if a person come with a very with dengue, okay, or if a person comes with malaria, if a person comes with diarrhea, okay, so all these patients, they will be treated in the this one only, community health center. So these are called as medicine case. Okay, so those which does not require any form of surgery. Then maternal and child health. So if you say maternal and child health, what type of services is provided? Like for example, they will provide antenatal checkup. So antenatal checkup, it is that checkup which is done during the pregnancy time. So the mothers, time by time, frequently they used to come to the hospitals OPD, and they will get their checkup done. Okay, so that is also one form of services provided to the mother as well as to the children. Okay, so that's why only, if you remember, we have some OPDs dedicated for the pediatric or for the children. So all those children or pediatric, okay, they will go and get their checkup done there. They will get the immunization there. Also, they will do the screening, okay, time to time. So this is some form of maternal and child health services. Then newborn and child health. Newborn also, what happened in this one community health centers also, they have some specific, if you remember, I've told you we had, they also have some specific rooms, okay, for the newborn babies. And if anyone is found to have any type of complications, so they will take care of the child there itself. Okay, so they have all the uh, facilities needed, okay, for the newborn, be it a radiant warmer, okay. So as you all know, because actually a newborn babies, they are very prone to having a very low temperature, okay, because they are still underdeveloped, right? So even the immunity is less. So we have to keep them in a very clean room and with lots of, okay, the room needs to be warm. So all this, so in this type of CHCs, usually they have all the radiant warmers. Okay, they have the facilities. Okay, if anything happens to the newborn, if any emergency care is needed, or if anything, so they will take care of the child in the community health centers. Then also family planning and contraception. So here also, if anyone wants to adopt any form of family planning methods, okay, so family planning methods, okay, so they will go and get all the services here, okay. Then the other services is like school health. So school health is means like time to time, okay, sometime what happens, so some personals from the centers, they might go to some schools, they might do some screening, okay. So especially, school children, they are very prone to even like dental caries, they might be prone to hookworm infestation or different forms of diseases. So they will go to the specific school on a specific day, and they will do some screening of the school children. And during the screening time also, they might give them some form of health education, where they will tell them about what are the, oh, it's suppose simple health education, like suppose balanced diet, dental hygiene, okay. So by doing all this, it really helps. So this is like some form of services which can be done from the community health centers, okay. Adolescent health. So actually nowadays, even in the community health centers, also we have some adolescent clinic. Okay, so adolescent clinic, it is mostly dedicated for the adolescent, children and all, adolescent, this one. Okay, because what happened? Because adolescent age, actually, so many boys and girls, they might be having like, they might be prone to so many, because they are still growing up and they are still this one, right? So they might be prone to so many form of diseases. And like even they, even in this even not only that, even counseling and also all those counseling services, then even treatment of any problem if they have, so all those will be done in the adolescent clinic, okay. Then elderly healthcare, so for elderly individual also, in the community health centers, so an elderly individual can come to the center. They will then, if needed, they will do the health checkup, then also they will provide them with any specific treatment that they have, be it hypertension, or if they have anything related to diabetes mellitus. So all those, it also will be done in the community health center. So outreach services in schools, okay, this is essential. That means this needs to be done. Okay, like I've already given the example how some personals from the subcenter, from the CHCs, they might go to some school and they might do some form of health screening. Okay, and community camps. Okay, so sometime what happened, this is desirable. That means if possible, we can do it, otherwise it's not that compulsory. So community camp is where we can go and like we can have some health camp type. So in a health camp, what happens, so we can, it can include the doctors, the nurses, some lab technician and all. Okay, so we can plan in one day. It can be for 1 day or 2 days health camp. So in a health camp, the community people, they can come there, they can get some free checkup, then they will also give them some counseling, okay, health education. So all those is done in a health camp. Then blood storage facilities, okay, is also there. Diagnostic services, so diagnostic services means in for, we have, like I've mentioned, we also have some x-ray rooms, okay, we also have some laboratory, okay, investigation rooms. So in those, uh, we can do all the diagnostic tests and all, okay. So referral services, so even here also, actually for referral services also, here we also have some ambulance. Okay, so if any patient, again, if any individual, if he need further treatment, okay, so if they don't have it in a community health center, so that individual, he can be transferred to another hospital, like it can be district hospital, or for example here we can transfer the patient to a GMCH and all. Okay, so like that, that is the meaning of the word referral services. Then transport services, like I've said, they also have some ambulance. Okay, so with the help of those, they'll be transferring the patient that needs to be treated in other facilities or anything. Then national health programs. So similarly here also, in we have, so if you remember also, I have already mentioned, we have so many national health programs in our country. For example, is the national AIDS control program, okay, which is dedicated to prevent the transmission of AIDS, okay, especially among the vulnerable group. The national program for the control of blindness. So in all these programs are also being implemented or being performed, actively involved in the community health centers. So apart from this, also we have so many health programs. We have the National Tuberculosis Control Program, okay, for tuberculosis, National Vector-Borne Control Program, that is mostly for the control of malaria, dengue, Japanese encephalitis. So all this, so all these also are the some of the services which are provided in a community health centers. Okay, so I hope everyone is clear with this. Anyone have any question?
No, ma'am.
Okay, so this is about the community health center. So, so like the PHC and the CHC, so in community health center, we don't have any type A or type B. Okay, we only have specifically only one, which covers 80 to 20,000 population. Okay, so I will continue with one more topic. Okay, so now I will continue with one small topic on globalization. Okay. Okay, so I hope it's visible, right? Okay,
Yes,
Yes,
so
ma'am.
is it visible?
Yes, ma'am.
Okay, so today we will continue with the next topic, which is called as the globalization. Okay, so actually, what is the meaning of the word globalization? If you see in general, so it is a process of interaction and integration among the people, companies, and governments worldwide. So that's with like every day, even now, if you see like because of the improve in the communication, so people they usually communicate, they do trading, marketing. Okay, so this is going on between so many countries, okay, suppose with neighboring countries or even with any other countries. So even among the medical, even in medical or even in the healthcare services, globalization is actually growing at a very high rate, okay, because so this globalization actually what happened, it has got some positive aspects also and also some negative aspects. So with the globalization, what happened, if people suppose if he need any further treatment in our own country, if it's not available, then he can go and avail that services, or he can get a treatment in another country or in another this one. So this is like how we are exchanging, we are cooperating among different countries. Okay, so globalization, it means that is actually what is the meaning of the word globalization. Okay, and this globalization, it has as related since the 18th century to the advances in transportation and communication technology. So now it becomes very easy, even if you need any treatment anywhere. So easily, if you have the proper communication, if you have the money required, then you can go and get your treatment done in another country. So that is actually what is the simple meaning of globalization, where we travel, where we get transport. Okay, some people might go to, some of us we might go to foreign countries, and some people from the foreign countries, they might come to India for treatment. So that is actually called as a globalization. So even in healthcare nowadays, it is growing so much because everything is becoming very uh, easy because of the transportation. Okay, so healthcare is undergoing a very dramatic globalization, and healthcare services has been expanded globally, and many travel from developed country to low or middle income countries to avoid high costs or long delays. Okay, so actually, in other words, what we also call it as a medical tourism. Okay, tourism actually, I think you understand, right? Where we go and visit some places. Okay, so in medical tourism, what happened? You go and visit some country, but you are going for what purpose? For getting some treatment. Okay, so that is also called as a medical tourism or the health tourism. We call it in medical term. Okay, so it is a process of traveling to another country for medical treatment and use of healthcare services. So it's actually quite benefited for the individual, especially those people actually from developed country and all. Okay, because what happened in their country, it might be even a simple dental surgery, it might cost so much amount. So by coming to like developing countries, especially India. Okay, India, then Korea, so all these actually they are very hot spots for this medical tourism, because here what happened in our country, we are getting goods, they are getting good services with a very less amount of, okay, or with a very less cost. So that's why our India also, it becomes a very hot spot for medical tourism. Okay, so it's where people come and travel to different countries and they get their health services done. Okay, so what are the effects of globalization in the healthcare services? So like I've said, it has got a positive effect, as well as a negative effect. So the first is the affordability, okay, especially for those people coming from a developed country. So if they come to a country like India, okay, or it can be any Asian country, so it's the price is actually very affordable for them as compared to them in their own country. So it is quite affordable. And cost effectiveness, okay, usually they usually get a very within a good price they can get their treatment, or it's quite cost effective, okay. Then high quality healthcare services. Okay, so with a very less cost, okay, with an affordable price, they are able to get a very good quality services, okay, and availability of medical experts. So they get opportunity to choose, okay, good doctors in a very reasonable price and a very affordable. And now with improve in communication, so it becomes very easy. They can sometimes what happen. First, they need to get their visa done. They need to get their okay. So with that visa permission, then after that they can come some, and even most of them they can even book their appointment online. So through online appointment they can book their appointment, and they can come after they get the visa done. Then they can come and get the health services. And what are the and one of the other positive effect is immediate services needs can be provided. Okay, but because what happens sometimes in some developed countries, even to get some simple treatment, also they need to wait for so many days or so many. Okay, so if they come to a country like India, no, so immediate service they can get, and rapid response to epidemic and catastrophes. Okay, so when you say epidemic, it is something which occurs, any form of disease which occurs in a particular community. Okay, catastrophes is something which happens very suddenly, okay, like sudden rise increase of some form of communicable disease or something, that is called as a catastrophes. So what happens with the help of globalization? So if you can see also nowadays what happened, if anything, if anywhere any people are suffering with any form of epidemic, so the countries, we are helping each other, like on one country they will also help another country. So that in this way you can really see that how globalization, it really helps in improving the healthcare services. Okay, so it also improved the communication process. So these are some of the benefits that we get from globalization. Okay, so what are the negative effect actually? What happened? So there is a risk of exposure to infectious disease. Yes, because if you travel in a country, okay, so that's why before traveling to any country, you have to fast check, okay, check properly whether in that country if there's any form of epidemic going on, if any disease. So you have to be very careful. Okay, so you have to check first properly, and even you yourself. Suppose if an individual, if you're already infectious and if you go to the particular country, you might infect those people in that particular country. So actually the risk of exposure is there if you travel from one area to another area. So the risk of exposure to infectious disease is also there when you travel. Okay, increased cases in emerging and re-emerging disease. So why emerging means these are those disease which are occurring at present. When we say re-emerging, is those disease which have appeared before but it has disappeared, but again it starts reappearing again. So why this thing is happening? Because what happened, because this is mostly happening because of traveling. When people travel from one country to another country, so they are also carrying the disease. Okay, they are also carrying the infection. So in that way, so again with some disease which are already not there, suppose in my country already smallpox eradicated, then if again from foreign country, if anyone comes who is having this problem, if he comes to our country, then he might give that disease again to our country. So in that way it re-emerge again. So that is the meaning of the word emerging and re-emerging. Okay, so emerging, it's already there, means it is that disease which happens at present or which emerge. Then re-emerge means it was there before but it has stopped, but again it emerge again. That is the meaning of the word re-emerging. Okay, there is also increased risk of complications, because what happened, suppose especially if you don't have any good follow-up services. Okay, so it is quite risky, because later on what happened to you, suppose if you do some surgery in a particular country, again if you come back to your own country, so if proper services is not there in your own country, so it will cause quite a risk for you. Okay, if anything happens later. So that's why it is also causing increased risk of complications. Standards. So when we talk about standard, it's like, because some countries the standards, it differs from country to countries. Okay, so some you'll be getting a good standards or high quality care with a low price, but some you will not be getting a good standards, or the quality of care might be different. So that is the main negative point. Okay, the non-availability of easy access follow-up care. So follow-up care, when we say follow-up, it's suppose you have already done your appointment, you have done your checkup, everything done, you go back to your own country, so you need some follow-up. Okay, so for follow-up also, sometime what happens, it also depends from hospitals to hospitals, how is the follow-up policy. Okay, so if the follow-up policy is good, then it is very advantageous for the individual. But if they don't have any good follow-up services, then it will cause many problem later on. Okay, for the individual, if anything happens later to that particular individual after returning back to his own country, so that is quite, it might cause some form of complications. Okay, so these are the, what are the effects of globalization in the healthcare services. Okay, so as you can see, globalization, it really helps and improve the healthcare setting, like especially in emergency cases or in any form of emergency disaster and all. So health services, it can be easily we can easily transfer it, or we can help each other during any form of epidemic and all. Okay, so that is the simple meaning of globalization. Okay, so globalization is like how different countries, they used to interact among themselves. Okay, and also how the people from one country, they go to travel to another country to get the healthcare services. So this is how the globalization, it has impact the healthcare industry. Okay, so it has got a positive impact as well as it have a negative impact. Are you clear with this? Yes or no?
Yes,
Yes,
ma'am.
ma'am.
Yes, ma'am.
Okay, actually, I have one more. Okay, so I will end this now. Okay, you please rejoin again. I have one more topic, only few slides left. Okay, because my timing is almost over. Okay, you rejoin again after 5 minutes. I will take only 5 minutes more. Okay.
Okay, ma'am.
Okay, thank you.
Ma'am.